Sister Mary Glowrey is a remarkable woman whose life and work have inspired many. Her incredible journey and the lasting impact she made on healthcare in India is a story worth sharing. A humanitarian, advocate for women's rights, and a systems thinker, Mary devoted her life to improving healthcare in India, where she expanded a small mission into a full hospital that cared for 637,000 patients between 1927 and 1936. She went on to establish healthcare systems and institutions that now look after more than 21 million people annually. Born into a devout Catholic family in 1887 in the Victorian town of Biragura, young Mary Glowrey's compassion and intelligence shone early. Inspired by her faith and a desire to help others, she embarked on a path few women of her time dared to dream. In 1901, she obtained a scholarship for 3 years, which enabled her to pursue her secondary education at South Melbourne College. In 1904, she was awarded a scholarship to Ormond College to study for a Bachelor of Arts. But she switched to medicine in early 1906, a time when there were few female medical students at the University of Melbourne. Mary began her medical career at the newly founded clinical school at St Vincent's Hospital in 1910. She completed her medical residency in New Zealand in 1911. When Mary returned to Victoria, she focused on improving the health of underprivileged women and children and became the first general president of the Catholic Women's Social Guild. She supported this work herself through her appointments at St Vincent's Hospital, the Victorian Eye and Ear Hospital, and her private practice. After reading about the appalling death rate among babies in India, Dr. Mary Glowrey responded by becoming a medical missionary with the Congregation of the Society of Jesus Mary Joseph as a nun to work in Guntur in India's rural southeast. She saw it not just as a career, but as a calling to serve those most in need. Leaving behind her comfortable life, Dr. Mary Glowrey sailed to India, determined to make a difference. Her journey was not just across oceans, but toward a deeper understanding of her faith and purpose. In Guntur, Dr. Mary Glowrey's impact was immediate. She treated thousands, from the poorest of the poor to those in high places, with equal compassion, often receiving payment in smiles and prayers. Inspired by the sheer size of the task of improving healthcare for India, she pioneered institutions to educate Indian doctors, nurses, midwives, and pharmacists. She was instrumental in establishing St. John's, Bangalore, one of the most respected medical colleges in India. Dr. Mary Glowrey's work went beyond medicine. She integrated her faith into her practice, offering not just physical healing but spiritual solace. On 29th July 1943, she established the Catholic Hospital Association, CHA, which in 1956 was called the Catholic Hospital Association of India, and from 1995, the Catholic Health Association of India, CHI. It has now the largest health network, boasting 3,518 member institutions. There are now over 1,000 sister doctors across CHI following in Mary's footsteps. Dr. Mary Glowrey's legacy lives on through the hospital and organizations she founded and the lives she changed. As the first religious sister to be a fully accredited doctor, she paved the way for countless others to follow in her footsteps, serving with faith and compassion. Dr. Mary Glowrey's compassion, dedication, and innovative approach to healthcare made her an exceptional human being whose legacy continues to inspire people from all walks of life. Dr. Mary Glowrey, servant of God, a life dedicated to compassion and service.